Patients who have, let's say, diabetes again, we go back to that terrible disease process of diabetes. They have problems with malabsorption in the gut. They have problems with problems with everywhere throughout the body, but malabsorption in the gut is a big problem. So the better that we can have and offer a nutritional supplement for absorption in the gut of not only the ingredient of Arginext that we're going to give them, but it also enhances the absorptions of vitamins and minerals, which we also have in our product. There's no other product on the market today that has the amount of estrogen that we have in our product. So we really hit a grand slam when we were putting together the product. Plus we have other ingredients, other minerals such as our magnesium. We found out that 90% of our patients were deficient in magnesium. This is the second most important electrolyte in the body, important for the heart. And these are the things that I see daily in my clinic when I'm treating my patients with cardiovascular disease. We also came across some other ingredients that enhanced the absorption of L-arginine. And fortunately for our patients, we were able to take those ingredients, blend them together, and come up with a product called Arginext, a product that works from the inside out and from the outside in. Because atherosclerosis, hardening of the arteries, is something that we have a product that works on reducing the arterial stiffness. And our type of arginine alpha-ketoglutarate works on the endothelial lining, which is a single layer lining of the entire arterial structure. And as Dr. Siva will talk about, we're trying to make a 2-lane highway into a 4-lane freeway so we can get better oxygen flow through the entire body. With our nitric oxide, our formulation doing that, we're taking that supplement. What it does is that it works on that endothelial lining and causes a relaxation of that. It opens up that artery, giving more oxygen distally, okay, to the distal part of the organ that needs it, okay, in this case the heart. Less anginal events occur. What we do in our EECP therapy, okay, protocol for us, protocol at the Heart Institute. And part of our data collection, everything is showing how our blood pressures are going down, okay, from the combination of both the EECP therapy and the Arginext. I will be able to give this in warm water, okay, to a patient who's hypertensive, and in 20 minutes, I'll have a decrease in systolic and diastolic blood pressure because of the action of what this precursor, arginine alpha-ketoglutarate precursor nitric oxide does. Increase energy. Increase energy. And all of our patients keep telling Dr. Siva, boy, I tell you, I don't know when I'm taking this product here, I sure had a lot more energy. Then when we do our other studies, okay, we did a lactic acid study on runners. Because remember now, we're opening up, okay, that arterial blood flow. And we open up that arterial blood flow, it reduces lactic acid. So here you got your biggest muscles here in the thighs. So we took runners and we did lactic acid studies on the runners, and we got 100% reduction in lactic acid. We got longer distances on the runs, and we had shorter recovery times. Renal insufficiency, we were able to use our patients with congestive heart failure who have used diuretics on a daily basis. These patients, we've been able to watch their creatinine levels stay stable or we go down. We're watching our patients with peripheral vascular disease. We're seeing improvement in vascular flow. Our wound healing for our patients with diabetes, we're seeing improved wound healing. Remember, if we can get that 2-lane highway into a 4-lane freeway and we have to give patients antibiotics, we're going to get better, okay, flow of that antibiotic treatment, okay, distally to where the wound is needed by that aspect there. So this is probably one of the most unbelievable tools in my toolbox, okay, from a critical care aspect of nursing.